Warm welcome to the learners of Ayurveda, especially BA second year students or second phase students and MD Draviguna scholars. In today's episode, in our program, we will come to know the importance of Arogyavardhini, Vati or tablet, and the reference is from Rasaratan Samachya. Generally, people think that Arogyavardhini Vati is skin extremely useful in skin disease battle. I mean, what I meant to say, it's correct. But classically speaking, where does it mention? It is mentioned in Kushta Rogadhikara. Kushta Rogadhikara. See, in the system of Ayurveda, different types of skin diseases have been mentioned. In general, apart from that, Kushta also a leprotic condition mentioned, isn't it? So, generally speaking, whatever dravya applicable in Kushta is applicable in all the Dvagat Vikaras or whatever Dvagat Vikaras are there, can whatever Dvagat Vikaras supposed to come under Kushta Roga Prakarana. That is why, in a basic manner, by covering all the classical diseases into consideration, grouped the all the diseases in the Kushta. That is why in Rasaratan Samachya they have mentioned Arogyavardhini Vati useful in case of Kushta and related diseases or Tvagat Vikaras, whatever you say. In PG entrance examinations, they may ask the Arogyavardhini Vati reference Rasaratan Samachya and which prakarana it is mentioned. Is it not? So Kushta Rogadhikara you are supposed to mention. Is it not? So they may mention Pama, Kandu, etc. different diseases they may mention. But the correct answer will be the Kushtarogadhikara. Remember, in PG entrance examinations, generally the paper setters will not go for the contra problems in the sense. So why they? Because they have to ask the pinpoint questions based on the classical references only. Or in a general manner, if they are asking, the answer supposed to be in that particular group. In case of, for example, you take Dravya Guna, suppose Charaka is there, you take any Gana, one of the Gana, one of the Dravya, the following Dravya, is applicable in so and so Gana, or so and so Gana having the following Dravya. Like that, they may ask you. Otherwise, Gana, so and so Gana or Dravya or Susatvargikarna or Charakavargikarna mentions what? Is it not? The following is mentioned in Susatvargikarna. The following is mentioned in Charaka Vargikarna, Bhava Prakash Vargikarna. They may ask the Vargikarna name or they may ask the in the group drug name, they may ask the different ingredients, etc. etc. Is it not? So now anyhow, let us have topic on Arogyavardhini. Is it not? What are the ingredients generally? If you are watching all the ingredients, Parada is there, Gandhaka, Logabhasma. See generally Tvagata Vikaran is, you mean to say it is applicable only in Tvagata Vikaras in leprotic conditions or related to the leprotic conditions, not like that. See, you go through the Gandhaka, you go through the Parada, Gandhaka, Logabhasma is the best Raktavardhaka, is it not? Logabhasma is the best Raktavardhaka. So you need not separately mention again Logabhasma in the patient's prescription. Let us wait, totally go the Arogyavardhini Vati, go for the hemoglobin level, whether the blood quality will be, what is the quality wise and quantity wise, is it not here? So you use the whenever, wherever you are given Arogyavardhini Vati, you go for the blood levels also, check the hemoglobin level, whether it will increase the things or not, you will come to know, is it not? Now we are coming to the Abrakabhasma. What is Abrakabhasma? Mica calcinate, is it not? So it improves the immune system, is it not? It improves the immune system. Defense mechanism in the body. Now we are coming to the Tamra Bhasma, one of the best blood purifier. Triphala is their best Vatanavana Dravya. And people think that if I am taking Ayurvedic remedies, heat will be there, heat will be generated in the body, sir. I am having more heat in the body. What I have to do? I have stopped the medicine. Is it not? Of course, you might have felt some subjective symptoms, but we are not the right persons to reject the or to deny the subjective symptoms framed by a patient whenever, wherever we are using. We have to understand the practical difficulty in the sense. That is why more quantity of the water has to be consumed. More quantity of the water has to be consumed. And takra, buttermilk, takra, buttermilk. And in case of Pitta Prakriti, even in case of Pitta Prakriti persons, you can introduce Dadi also, curd also. So generally speaking, takra, dadi, water, all have to be consumed in maximum dosage. Nothing will happen because the heat will be reduced. If at all heat is there in the sense, people know, people will tell like that, is it not? You might observe the See, entire universe is a big lab, is it not? See, whatever observing under the microscope, whatever observing uh, under the different equipment with the help of the equipment is not a criteria. You have to observe the subjective symptoms of the patient and understand the practical difficulty of the patient also. Right? It contains triple I is there, and then what is the purpose triple I? Triple I is a Vatan Laguna, it is a Swasa Kasagara, Silajati, they are useful in urinary system infections, is it not? So now try to understand what are the important ingredients in Arogyavardhini Vati. Or Abrakavasma is there, Parada is there, Gandhaka is there, Logavasma is there, apart from Silajatu is there, Silajatu is the best one of Dravya and Sopa and related diseases, is it not? And also Rasayana in old age, and then Gugulu will be there, Gugulu extremely swell in Vatajani Vikaras and Kavajani Vikaras, Chitraka is there, best lake, Chitraka is the best Lakani Dravya, and Katuka is there, is it not Katuka? See, it is also best Lakani Dravya. But what is the major in pediatrics examinations? They will ask you what is the major ingredient, what is the major ingredient. So, Katakarogini will be the major ingredient. People think that it is useful in Tvagata because practically, see, analysis is different, clinically, according to your convenience based on the reference is different, you are understanding the concept, is it not? So, multiple drugs, when a dravya having multiple actions, when more drugs are there, how many multiple actions will be there among them, you find out the major ingredient. What is the major on the major ingredient? You are finding the efficacy, is it not? But see, you think it is mentioned in Tvagata Vikaras, it is mentioned in Kushtad Vikaras, is it not? When it is mentioned in Kushtad Vikaras, how you will apply this drug in obesity? Is it possible to apply this drug in obesity or not? In Panduroga, is it applicable to apply this drug or not? If you are analyzing like this, absolutely correct answers are there. You can apply these drugs in the disease, whatever stress is, even in edema, you can give it, even in case of edema also, you can give it. Find out the different ingredients and analyze them. Try to understand the rasa, guna, virya, vipaka. Then only you will come to know blindly, like where a medical rep will come and teach you, sir, these are the ingredients we have conducted the clinical trials, what is it not. In the system of Ayurveda, in a classical concept, in a classical preparation, promotion, you have to think about all the ingredients and their dose and their efficacy based on the major quantity of the dravya in a compound preparation. Is it not? Just go through the classical reference in how many doshas it is applicable, how many vyadis it is applicable, make a tabulation, apply it and confirm it practically. Worldwide, India-wide, if the people are doing, really, you will come to know, really in the sense, then only you will come to know, is it not? In one state, one people are having a target on only Arogyavardhini. Classically based on the doshas, classically what they are mentioned on the vyadis, you have to do like that only, is it not? We are supposed to do like that only. You select the vyadi or you select the dosha. Dosha is mentioned, which dosha it is functioning, what you find out. When vyadi is mentioned, which vyadi, under this vyadi, when the vyadi is diagnosed, definitely you can use drug. This is a method how to promote the classical concept, is it not? Round the clock, is it possible to go for the investigations? But nothing wrong in going for the investigations, is it not? Anyhow, come to our point. Now, in objective model category, but based on the category, it is extremely spelling is of Yakut Vikara and Pulika Vikara. What are the other ingredients? What are the other indications? It is a Deepana Karma and Pacha Karma, being a Deepana Karma and Pacha Karma, Madhura Rasa, Ati Sevandanya Vyadis, and then in case of Staulia and Staulijanta Vikaras. Okay, let us in object model question will be there. What is the Bhavan Dravya? What is the Bhavan Dravya in case of Arogyavardhini preparation? The answer is Nimba Patra Svarasa. Answer is Nimba Patra. So here three points are there, important bits. Number one, ingredients you have to go through. Number two, Pradhana Vyadi, the main Adhikarana you are supposed to go through, and then references. So reference, Pradhana Adhikarana, and then ingredients, okay, and then fourth one is major ingredients. So in this manner, now today we are given the classical concept on how PG entrance examinations, the bit model comes in it not. So follow this principle and prepare, sit properly and prepare all the object, all the yogas Vati Kalpana is there, Chodna Kalpana is there, different Kalpanas are there in the system of Ayurveda. Is it not? You go through all the things, prepare a chart for that so that you will have clinical maturity, subject maturity in the sense apart from that, even in the practicals also. I mean, if you are in case of a second year student, definitely this type of method will help you. Now, second year, BIM, second phase, how the question comes, I will tell you. What is the major ingredient in Arogyavardhini Vati? Kattakarogini. What are the different ingredients? Otherwise, in second phase, one concept is there, understanding the major yogas or Visishta yogas or Pradhana yogas. Is it not? Suppose it is an example in case of Kattakarogini, or even in case of Google, you can write this one next to Kattakarogini. The major ingredient goes to the major ingredient will be the Google. Is it not? So in BIM second page, it will be answered or it will be used like this as an answer in case of major yoga for Kattakarogini or major yoga for Google. Is it clear to now? Now in BMS second page also I have told you in Viva definitely they will ask you what are the major ingredients in Arogyavardhini, the major yoga what? Is it not? What is the major ingredient in major ingredient in Arogyavardhini? They will ask you. The answer is Kattakarogini. You are supposed to tell. This bit came many times. Understand the beautiful analysis of Ayurveda and apply this in our second phase examinations and MD, PG entrance examinations also. Thank you, sparing for valuable time. I am Dr. Simhadri, imparting the beautiful concepts, especially useful to prepare the bits in the sense. Thanks a lot for sparing your valuable time. Dr. Simhadri 9014141722. Exclusively online Ayurvedic Dravigana tuition, especially paper 1 and paper 2. This series will continue regularly. Wherever maybe you are, you just follow the beautiful concepts. This we are telling the Viva presentation bits, Viva answering questions in the sense, and then PG entrance examination bits, how they are applying. We are giving few examples. Based on this example, based on this model, you prepare the data. Definitely you can conquer or you can achieve the best seats in India, like Jaipur, Jamnagar, Benares, Hyderabad, top, Kerala, top, Ayurvedic college or then PG entrance, PG level I am speaking. So work hard today onwards. Let us have a smooth way of learning in a simplified manner. Our motto to make Ayurveda so easy for the benefit of the mankind. Thank you. Thanks a lot for sparing your valuable time.